In a move that is likely to trigger strong reactions, the Karnataka government is planning to introduce GPS tracking system for government doctors. This after reports of doctors carrying out private practice at the time they are supposed to attend to patients at government hospitals. Medical Education Minister K. Sudhakar said that they are working out the modalities or some other alternative will be found. Reports, in fact, suggest that nearly 10 to 15% of government doctors have been doing private practice during office hours. I am joined to discuss more on this. I'm joined by Mr. Ashok Gowda, spokesperson of the BJP in Karnataka, and Dr. Anand Lakshman, founder and CEO of Address Health in Karnataka. Thank you to both of you for joining us on this. I'll start by asking Dr. Anand Lakshman first for his reaction to this. This is, of course, pertaining to government doctors, what we are given to believe at this point in time. But geotagging of doctors in order to track whether they are attending to hospital patients or moonlighting in those hours, that is something which the Karnataka government seems to be perturbed about. But is this the right approach to deal with the issue?
Thank you. See, this is we have to go to a root cause analysis of this problem. Okay, so this is a solution in search of a problem actually, because it is not that truancy of doctors is something that has not been there in the past. We have to go into the root cause of what this is. This announcement was made in the context of Medical Education Department review by the minister, and if you look at this problem, I would equate it to the we have the cheetahs which have gone extinct in India, and we have now imported them and they have been geotagged. Similarly, doctors are a fast disappearing breed, and this is a way to sort of keep them intact. This is the kind of the problem analysis has to be far deeper to understand what the solution is. I don't think geotagging will create a solution. However, Karnataka is not the first state to mull it. Last month, Telangana government also has mulled a similar type of solution. These are solutions in search of problems.
But sir, I understand that you're saying that this is probably, an approach where a lot of doctors might object to. But let's also talk about, as you were saying, that there is a problem here. That, doctors, government doctors especially, who are supposed to be the best, who are absolutely the need of the hour at any situation, whether it is, in pandemic times or otherwise. But they are not attending, if you have to believe this report, 10 to 15% of them are not attending work in office hours at the hospital, but doing private practice. This is clearly a violation of medical ethics, so to speak, that your first duty, call of duty, is in the hospital. So that is something that even doctors, and you as a professional doctor yourself, would take cognizance that that is a matter which needs to be addressed. And the government will have to do something, and this is probably a drastic step, but they are looking at addressing the issue.
Yeah, so we have to look at it in the context of the department. This is Medical Education Department and not the primary healthcare centers and the Department of Health that this context is. Okay, please look at both things separately. If I take the example of Mysore Medical College, whose performance was reviewed by the minister recently, and it was said, there are about 220 odd doctors who are in the teaching staff of Mysore Medical College. Of this, around 160 are clinical staff. We are talking only of the clinical staff in this context because they have to attend to outpatient duties. The non-clinical staff are in teaching and paraclinical and preclinical work. So the 160 odd doctors, of that about 10 to 15% you are saying are not available during OPD hours. Okay, Look at it differently from, say, a primary health center, which is far away in a remote area where there is a single doctor posted to a particular OPD. There are contexts across India. For example, when I was working with WHO across India, where the private practice by a primary healthcare center doctor is being conducted in his own quarters, which is right next door to the government primary health center OPD building. So this kind of problem will not be solved with geotagging. Geotagging context comes in the context of what we are talking medical college. You have certain faculty. Are they within the department or are they outside?
Right.
So again, go to the root cause.
Dr. Lakshman, let's hold your thought there. Let's hold your thought there and bring Ashok Gowda in the conversation at this point in time. Mr. Gowda, as Dr. Lakshman also there seems to be making, that there might be a genuine issue here. But is this the right approach or even an effective approach? Forget about right or wrong, what people are feeling, whether their sentiments are hurt. But is this even going to be an effective approach in terms of geotagging doctors?
See, definitely it's one of the approaches only. See, what is government speaking today is there are several alternatives which we need to explore and which we need to work out. I agreed with Dr. Lakshmanji. What is he saying is in a primary health center where the residence is right next to the OPD, geotagging may not help. But in a city like Bangalore, where they are practicing outside when they are a government doctors, that might help. But this is not the only solution. There are several solutions. This is one of the solutions which is proposed. So doctors can all sit together, brainstorm, and say that, like, how do we bring accountability to the practice of the doctors in government hospitals? But at the end of the day, the healthcare system in Karnataka should improve, as well as the primary concern of the most people who cannot afford the private hospitals should be met in the government hospital. This is what the government believes in. But because of the moonlighting of the doctors, see, it looks like, because of the survey, it looks like 10 to 15%. Definitely, there is more number of doctors. There are a lot of states which have bought biometrics, but biometrics has not solved the problem. If they put an attendance, after that, they escape from the back door and they come back in the evening and then they use the biometrics. So this is the kind of the problem in biometrics. So that is why geotagging was the thought, but there are several other alternatives also, which doctors can bring up to themselves and suggest to government. Dr. Sudhakar is an open-minded person. He can listen to them and he can come out with a better alternative solution if there is any.
That's right. Did we also, Mr. Gowda just wanted to know, isn't a consultative process better? Shouldn't the doctors themselves be taken on board? Dr. Lakshman would also agree, and I will take his opinion on this, but isn't it better to have a consultative process? If at all there is a problem, let's address it. Let's at least rope in a few doctors who can also suggest what can be an effective process of taking care of this, because geotagging may be a lot of money involved in terms of setting up the operations, and it may not even be an effective mechanism to ensure that people are actually turning up for their job, in this case, doctors. So isn't it better to have a consultative approach to this entire issue?
Definitely, we believe in a consultative approach. That is why Dr. Sudhakar has clearly said there could be an alternative solutions. Geotagging is one of them, might be. See, what is the problem with geotagging is also that if you just ask me outside the context as a consultant, I could say that geotagging the way the biometrics is misused, the same geotag, they are doctors at the end of the day. So that means that they're brightest of the brightest. So that means they will use they will put the geotag on the OPD table and move out and do the moonlighting. So that might be a problem. But at the end of the day, there is several alternatives. There is the ethics committee which have to work, but the ethics committee doctors are also doing this kind of a malpractice. The person who is supposed to check on these doctors is also involved in the doctors to go out. So there has to be something called their own sense which has to work, saying that yes, I am on the priority duty. I see at the end of first thing is the rule in Karnataka or rule in the entire country states that if I'm a government doctor, I'm not supposed to practice outside because it's a conflict of interest. But yet some of the doctors go out and practice, and if it is outside the duty hours, generally what I've seen, forget about the government or anything, generally people don't bother, but within the duty hours, definitely it's a matter of concern, and definitely they have to be booked under, and in fact under criminal charges, and this is a negligence of duty and as well as playing with the patient's life. And it cannot be taken very lightly. So alternatives have to be worked out and the best solutions can be found. So geotagging is one of them, and the doctors can actually, in fact, when the government is coming with a proposal, instead of waiting for government to put up certain proposals, they themselves can now in the technological era, they can do the brainstorming sitting at their home, do one write up and send it to our health minister so that he can look into the alternative solutions.
Last word I would want to have of Dr. Lakshman. You heard what Mr. Gowda had to say. What would you, as a medical practitioner, would tell your fellow doctors? I mean, they might have several grouses, there might be issues, they might be in need of, the extra money in the pocket. But what would you actually tell your fellow practitioners? And also, what do you suggest to the government is a more effective manner in which this issue should be addressed?
Yeah, first thing is, bringing something like geotagging has actually brought spotlight to an issue which is not discussed. That is medical ethics and availability of doctors, not commonly discussed on channels like yours. Okay, so that to that extent, it is a useful method that it has brought attention to doctors and our community. Our simple part is, look, we have to focus on what there are two parts to it. One is medical ethics, one is what you are contractually obligated to, right? So if you are signed up to become a medical college professor or a teaching staff, and the contractual obligations are to working certain hours in the government hospital, you have to abide by your contract. There are black sheep in every profession. There are black sheep in the public health system as well. But this is not the solution. The root cause analysis has to go into pay structures, incentives, promotion mechanisms, other opportunities that government doctors get to make sure that human resources in health issue is addressed, and not that we are looking at, some kind of a solution which is more meant for animals.
Right. So the diagnosis is right, but probably the prescription is wrong in this particular case. Dr. Lakshman and Mr. Ashok Gowda, thank you so much for sparing your time and joining us on this very important discussion.